Hi, my name is Julian Geiger, and today I'm going to be doing a Foley catheter insertion. So upon entrance to my patient's room, I have performed my hand hygiene and introduced myself to the patient. As a student nurse today, I'm going to verify the first and last name and date of birth, as well as level of consciousness to person, place, time, and purpose. And then I am going to explain the purpose of the procedure, the catheter insertion, and just what to expect and everything like that. After that, I'm going to put on my clean gloves. And again, I have performed hand hygiene already. And then I'm going to move the drape into a diamond shape so that way I can drape the patient. And then I'm going to get the patient to lift her legs. Obviously with a real patient there would be a little bit more leg control, hopefully. And then I'm going to take the drape and wrap it around her legs, her ankle, and underneath her foot. And then I'm going to come on the other side, grab the drape, and do the same thing, where I wrap it around her ankle and underneath her foot. So that way, whenever the drape is lifted up, there's a clear view of the area to try and maintain some patient modesty. And also before beginning catheter insertion, I will double check if the patient has any pain, and if they do, I will get the pain rating and things like that upon my assessment before beginning the insertion. So now I would perform perineal care and cleaning with soap and water, just to make sure that the area is clean, no contamination or anything like that. Then I'm going to remove my gloves. And perform hand hygiene. And now I'm going to go ahead and open up my Foley catheter kit. I'm going to make this into a trash can, trash bag, and I'm going to place at my patient's bed, on my patient's bed at their feet, so that way I'm not turning my back on my sterile field or reaching across at any point whenever I need to throw things away. Okay. And then I'm going to orient myself to the kit. Open it away from me. Right, and now I can see everything in my kit. I'm going to first start by putting on my sterile gloves. That I'm going to do over here, just for the purposes of this demonstration, so you can see. I'm going to pick my, well, they're sticking together. I'm going to pick this glove up and orient myself. Okay, and then I'm going to get the cuff of the other glove. They are kind of stuck together. and orient myself. And now that both my gloves are on, if there was any adjustments that needed to be made, I could make those. I'm just going to move this off to the side. Typically I would throw it away, but I will just move this off to the side. And now I can touch anything in my kit. So I can take this drape that will go underneath the patient. I'm going to fold it and wrap it. Then I'm going to get the patient to lift her hips up. Obviously modifications are going to be made for this video, but then it would be laying flat underneath the patient, just like so. And then I'm going to pick up the drape that goes over the patient, making sure that the shiny side always goes down, so finding that shiny side. Sometimes it can be a little bit more difficult. Alright, and then placing this on the patient. The drape has fallen slightly, so I will just situate that as best as possible. Just like so. And now I'm going to go ahead and move my kit from over here onto the patient's bed, so I'm not turning my back on the sterile field at all. I'm going to go ahead by opening up my swabs. And pushing them up to the top of the package. Just like so. And I would also make sure before beginning anything that I ask my patient if they have any allergies to iodine or betadine, if I were to be using those in the hospital setting to clean the area. So now I'm going to take the swab sticks. I'm going to clean on the outside, or just one outside. Excuse me. Just one side at a time with one swab stick, and then take another swab stick and go on the other side and discard in the trash can. Take one and go on the inside on one side and discard, and then take one and go on the other side, discard, and take one and go straight down the middle and discard. And now I'm going to open up my lubricant pouch. And go ahead and squeeze that out in my tray. Then I'm going to pick up my Foley and open the tubing as much as possible with the way that it's laying, and take the very tip and put it in the lubricant. I'm going to set it there and pick up the rest of the tubing. Oops. Trying to make sure that it does stay in the lubricant as much as possible. And then I'm going to get the rest of the plastic off. And sometimes you may have to take it out of the lubricant to untwist it. But then you're going to put that in the trash can. So as you can see, the sterile drape did fall. because I have not touched anything that was non-sterile, I will just resituate this back up, just like so. And I'm going to take the solution and connect it to the tubing in order to be able to blow up the balloon. And now I'm going to remove the edge, the tip of the catheter. I'm going to begin with insertion. So can you take a deep breath for me? And I'm going to shove it in until I'm able to see urine flow into the catheter. And then I'll go a little bit farther than that. And after that, I'm going to begin to blow up the balloon. This balloon does say 5 milliliters, so I will put 5 milliliters in. Okay. And after that, I'm going to detach it and throw that away. Then I'm going to take the bag, place it down at the bottom, clip this to the patient's sheets, and then typically I would rip that and pull the drape down, but for the purposes of this demonstration, I'm just going to leave it, but you would have that ripped and all that picked up and situate the patient. You would also have a pad on the leg to stick this to, and yeah, that's it.